But I'm just going to start off by welcoming you guys to our weekly live question and answers for Move Charity and 5K Your Way. This is actually the last one of the series before we take a much needed break over August. We've been going full steam ahead all the way through lockdown, and I think we just need some time to reset, recover, and also get, hopefully we're going to have something quite interesting, exciting ready for September. So watch this space. But today with us, I have the amazing opportunity to welcome Dr. Professor and MBE Anna Campbell to our question and answer. So is that the right titles, Anna? Is that enough?
Just Anna is fine by me.
So I'm just going to give a little bit of introduction, Anna, and then obviously we'll let you introduce yourself. So absolutely. Just check in. We've got hello from Hayley, hello from Thomas as well in our chat box. So great to see so many people watching. So I'm going to welcome Anna, and Anna is the director, so I'm going to try and read this out and get this right, Anna. The director of CanRehab, which is an international training provider for exercise-based cancer rehabilitation for health professionals and fitness professionals. And I'm lucky enough to have been through that training myself, and when I first met Anna, so we'll go through that in a little bit afterwards. You are also part of a working, I thought this is really important to tell everybody your background, because I don't think everybody really knows how much you do and how much an influence you have on this space, which is frankly amazing how you balance everything. But you're a part of a small international working group of exercise experts responsible for updating the evidence around exercise prescription guidelines and the guidelines for the provision of clinical and community-based exercise programs for cancer patients and people living with and beyond cancer. And there's been a recent study in 2019 that was published. So I know that anytime I need a paper or a study or some research, I definitely know who to come
yeah, exactly.
to. But you're also are you still a professor in clinical exercise in Edinburgh? And Napier University?
Edinburgh Napier, yes.
Yeah, Napier University, and you have a first degree in immunology and a PhD in biochemistry, which is very impressive. But also, I guess you've worked for 19 years in the field of exercise oncology, and actually been instrumental in, definitely for myself, in learning, from you around exercise and cancer and just the wealth of knowledge, experience that you have, which is amazing. But you've also done a lot of work and done a lot of consultation for Macmillan, Breast Cancer Now Fund, NIHR and CSO grants and research projects over the years as well. Have I got that right?
yeah, all the different grant application bodies, great fun applying for them, yeah.
Yeah, I just think it's really important for people to see that and understand that, because I don't know anybody else in this field that has your experience and knowledge, and just the passion for, exercise and cancer in this space is just, it's contagious as well. Because I remember, just to go back when I first met you, Anna, and
what year was that again, Gemma?
That was on the cancer rehab course, wasn't it? I signed up for in London. I think
in London.
Tottenham way, I think.
Oh,
yeah. Me and my friend Emma, and I'd had cancer the year before and decided I wanted to become a cancer rehab instructor. Yeah. So I went through my qualifications I'd already had a sports science degree, but went through my qualifications to be a personal trainer, and then found your course, and it was the only one, and it still pretty much is the only one out there to become qualified in cancer rehabilitation. And I remember meeting you, and when you delivered the course, in Karen as well, I just was so inspired by, your knowledge, your passion and enthusiasm for this area of work. And I think since then, going to Club Losandra in Lanzarote with that program and seeing the work you've done, it's really, you definitely influenced me and inspired me in this career. So there's a thank you there as well.
That's wonderful to hear. And I think I am so passionate about it, but I feel absolutely privileged to be able to work in this area. It gives back more than you get back more than you actually give.
Absolutely. Yeah. So Anna, I was going to ask you, where did your passion start for this area of work? So obviously degree wise, but why did you get into it?
It's a great interesting thing, because I give a lot of talks to young people at schools and colleges who don't know where they're going to go, and the reason why I do this is because nobody would have imagined when I started my degree I'd end up where I am. degree in immunology, a PhD in biochemistry, a lab scientist sticking around with isotopes and cells. But when I finished working in the lab, I decided I'd like to do something different. And I ended up working for the company that made Dolly the sheep, which is,
wow.
So I was working in the biotech industry, and I realized that when I was out traveling the world telling him about this great technology of cloning, I realized actually if I feel passionate about something, I'm quite good at teaching and training and inspiring. So I decided to do a master's in sport and exercise. 2 degrees weren't enough. I decided to do another. And this is way back 1998 to 2000. And when I finished my master's degree, a friend of mine who was a nurse said to me, do you know, Anna, I tell all my breast cancer patients when they're on chemo, they must stay in bed, they must not move, they should do nothing at all.
Just and what year was this? What year was this?
Year 2000.
Yeah.
So that was a message that every single healthcare professional was telling anybody with cancer, that while you're on treatment and even after, whatever you do, to rest as much as possible. So she said to me, can you look and see if there's anything in the literature? And I thought, right. And there was virtually nothing. Now, I trained as a cardiac rehab trainer, and I knew that they were all being told to be active after a heart attack. So I thought, why aren't people that have had this? So that's when I started to realize my knowledge of science, my love of medicine, my desire to teach was all coming together. And I thought, right, we need to do some research into this. So that's where, before I tell you how much it's moved to nowadays, when I first started, the first thing we did, our first trial was, is it possible that if I set up an exercise program for anybody during chemo, would anybody come? That was all we wanted to find out. And what would it be far too much?
Yeah, and what was the response then? Because that was obviously quite, you know, even when I was treated in 2012, you know, people were still being told to sit and not get active. So what back then, like, what was the response to?
So Gemma, the response was that we asked the breast care nurses, and this is 2003, and lo and behold, out of maybe 1,000 people that they saw, they only gave us 20 to work with. And they were the young, fit ones had been active prior to diagnosis. Nobody else was picked because they felt it might be dangerous for them to be active.
It's quite interesting, isn't it? Even with limited information, they went on the other side rather than the positive kind of what could movement do for you?
Yeah, very protective. And thank goodness it's changed a lot. But that was where we realised that we need to prove that it's not dangerous. And that was number one. Our first study was just to say, can we prove this is not dangerous and can it improve quality of life? So just a very general thing. And lo and behold, we found it did, but we'd only had 20 people in it. So Cancer Research UK gave me and my colleagues a big grant where we got 200 women right in the middle of chemo radiotherapy. Randomly, 100 were put into a structured group exercise class, and the under 100 were told just to keep doing what they normally did. So they weren't given any advice. And at the end of that, they get the program, we found that, as we'd expect, the women were feeling better, they were being able to be more active, their quality of life had improved, less depressed, less tired. So that's where the big studies started. And it was not just me, but colleagues all around the world began to look at this as a proper feasible thing. And so that's where it all started, way back in the early 2000s.
Yeah, and like you say, it's like you may have not seen your career going this way, but I love chatting to you when you bring everything together, because I think sometimes research is so, people just don't present it in the right way in order to be able to make it happen in real life situations. And I feel like the way I talk to you, I understand research even more than I ever would just reading. You bring it to life and you then make it happen in reality. And I think that's something that you have over a lot of other scientists and researchers, that there's a difference. You want to make it into a practical prescription service, or like a practical advice, rather than it just staying as a research paper.
Yeah, and that's where all my friends call me a pracademic.
Oh, do they? Yeah, I was thinking of that word, actually.
They call me a pracademic because you know all the academic stuff and you can spout off all these randomized control trials and effect sizes, but that's not enough for you. You need to say, okay, this evidence is out there, but what we're going to do with it, I don't want it just sitting in a paper or a journal, or we need to get it where it's working and it's having an effect with real people with cancer and
and I love that, because I think from my personal perspective, I haven't got the research background, but I had cancer and I was wanting this research to be shouted about, and actually, like you said, made into a situation where I could look at something and say, what is that next step for me in terms of exercise and my cancer diagnosis? And even in 2012, that wasn't there as much as it is now, but there was to some extent. And like you say, I think where we're moving to now, I'm not sure it's just because I've had a conversation actually with Helen, who's on this, she's listening in, Helen Quirk, and we've said about, actually, is it just because it's in our space? So when we're on Twitter, we see everything about exercise and cancer because we're following the right people. But I feel there is a lot more noise around it. So what I was going to ask you, actually, where are we now with that evidence and research in exercise and cancer, and where are we in the UK compared to other countries around the world, like some of the leading countries, say Denmark or Norway or the Australia as well? Where are we in comparison to that?
So there's two parts to that. Where are we with the evidence? So that is very much, I'm going to tell you where we are is fair, where the evidence is strong, the exercise does have real benefits. And then I'll talk to you, where are we as far as implementation? So let's look at the research aspect first. There have been loads and loads. I mean, the amount of papers that are coming out, even though I've got alert, I'm finding it hard to keep up to date with all the papers that are coming out. So rather than spouting 20 million papers about you and what they find, what I can do is say there's certain things where they've now shown the evidence is really strong. And as you said, Gemma, in 2019, a whole international group of academics, plus charities, plus health professionals, plus various cancer bodies from the world came to San Francisco, and we decided to try and update where the evidence was at that stage. And it's moved on a little slightly since then, but what we did is we published 3 papers. The first paper was to say, what is the evidence exercise prevents cancer or prevents cancer recurrence, and how do we think that happens? The second paper is, what are the current guidelines? What is the exercise prescription? And the third paper is, how do you put it into practice? So the first paper is the one where it's looking at, does exercise stop the cancer, you getting cancer? And if you have cancer, does being active and exercising reduce the risk of the cancer recurring? As far as it's concerned, when I started, there was only 2 cancers where we could definitely say that if you're active, you'll reduce the chance of getting those cancers. And those 2 were breast and colon. It's now up to 8 different cancers. So that now includes stomach, kidney, bladder, esophageal, endometrial, and I think there is one more. I can't remember the other one, but there is a list of 8 cancers now where the evidence is now showing that if you're active, now remember, it doesn't say if you're active, it means you won't get cancer. We only can say it reduces the risk, or it stacks the odds against you getting it. Because as you know, people do everything and they still get it.
And I've had people say to me, but you were active and you got cancer. And I was like, yeah, but the fitter I was, the more my body felt prepared for what it had to deal with. And I was going to say to you, Anna, with that 8, the reducing the risk of those 8 cancers, is it likely to be more, but it's actually a lot of research has gone into those 8 cancers?
Correct.
So I thought
there's 1 or 2 where there's definitely no evidence. And one of them is rectal cancer. There's no exercise, so they've definitely proven definitively not. And the other one where exercise increases cancer incidence is melanomas. So that's the only one.
Being outside,
So there is actually a slight opposite, and that's where we all know slip, slap, slop is really important, that if you're outdoors a lot, but the rest of them will be. Now, the other interesting thing, Gemma, is that they've looked at the dose response. They now say that if you want to stop yourself, if you want to reduce the risk of getting cancer, you have to do at least 150 to 300 minutes. So it's actually, you need to do more than I was told originally. So you always have to do at least 30 to 60 minutes a day of activity to reduce your risk of cancer.
And that's so interesting, because I think that sounds a lot, but actually, we were told, 30 minutes 5 times a week really we should be moving. We're designed and born to move. And I think that you look back at when you're children don't stop moving. But for some reason, when you become an adult, there's a hell of a lot of sitting in your life, which, you know, our bodies and our muscles just aren't, it's not good for us anyway. And I think people think, you know, asking me to move 30 to 60 minutes a day, is that actually out of a, you know, 24-hour day? Is that a lot? No, really, no, it isn't. Absolutely. Yeah.
People do. I always feel worried when I tell them that, you know, I like that. But I think, you know, I've got a watch, and if I'm doing the washing, or I've hung out the washing today, so that's another 10 minutes of activity. You don't need to say, right, time to do the exercise. It's really just doing things around, you know. I've got the puppy, so I walk her a couple of times. So you can accumulate it without thinking, I have to do a structure of 60 minutes every day.
Yeah, and I think that's the issue. Like, I always talk to people around, just reduce your sitting time.
Yes.
And if, you know, you don't have to suddenly go in at, you know, 150 like minutes or more than that per week, but gradually build up. But just try and reduce your sitting time first. And like, we are designed to move. And like I know from the research that's been done, they say if you put exercise into a pill, we would all be taking it.
Yes.
It's just because it requires that little bit of physical and mental effort to take the first step to get into a routine. So and we could talk more about that later.
So that's the kind of overall. And then for cancer survivorship, it looks as if the big, again, this is just because the ones who've studied cancer survivors are breast, prostate, colorectal and endometrial, and they're the ones where the evidence is beginning to accumulate that if you have had a cancer diagnosis and you stay active, if you compare yourself to somebody who was completely sedentary, didn't move around, then you'd have a 30% risk reduction of the cancer coming back compared to somebody who's sedentary.
Yeah, which is huge, isn't it, really?
It is, absolutely. I mean, when you think some chemos that they give you are reducing the chance of coming back by 5% or 3%, or some of the hormone treatments, this is a 30% risk reduction. So as far as a lot of people ask me, right, what's the science behind it? And where we are with the evidence there is one of the biggest things we've now discovered is the immune system is really boosted. And so our immune system has a way of watching what's going around the body and eating any rogue cancer cells. These are called natural killer cells and T cells, and exercise boosts them so that your body's way of recognizing and destroying any cancer cells. It also regulates our insulin, which is something, again, that cancer cells feed on, the various components of the insulin pathway. It also dampens our immune inflammatory system, which is always really good for helping you to stay healthy. It helps you regulate that healthy weight. So the less fat cells you've got, the less chance you've got of the cancer recurring again. Your cardiorespiratory fitness. But from a psychological perspective, it gives you the confidence to get back to doing your normal things. It gives you a bit of control back on your life. And lots of different things. And then last but not least is they think that and they've shown studies that if you exercise during chemo, you tend to get the full dose if you're active, whereas if you don't do any activity, you have to lower your dose or you're more likely to miss doses of your chemo. Therefore, you're not getting the recommended amount. And that was a big trial where they showed that people who were put on an exercise program were able to stick to the treatment. Just as you said, it makes you able to really maintain going through that horrible chemo or radiotherapy.
Yeah, and I think that's the big thing around that I think people still don't have as much of an understanding of, because I think when you get diagnosed with cancer, you're not in this space. So it's usually you pick up that sort of information when you've had a diagnosis and you're looking for that advice on how to get through treatment better and how to keep your quality of life. But actually, like you say, there is a part to say pre-diagnosis. You know, I definitely, my treatment was really, really aggressive. I went through Codox-M and really aggressive treatment a lot in hospital. But I definitely knew that because my body was fit and healthy, and I was told that they could literally hammer me with as much toxic treatment as they can to get rid of the cancer. And actually my body was able to cope with that because of the fitness I had going into the treatment.
Yeah.
And like you say, then that has a knock-on effect on the infections during treatment, in between chemotherapy. You saw other side effects of treatment, short-term and long-term. like your own quality of life during that treatment and what you could do. And don't get me wrong, it does knock you for 6, but you're probably it's not knocking you for 6 as much as it would do if you weren't in that situation.
Yeah, only knocks you for 2.
Yeah. There's no going around it. Having treatment for cancer, whatever it is brutal. But like you say, it's like, and we interviewed Heli from Active Against Cancer in Norway, and she used an amazing analogy in terms of, like, you wouldn't go into a marathon, well, some people would, unprepared. If you go into unprepared, it's going to be, you'll be all over the shop, and it's going to be a worse journey. And basically you go into your treatment prepared, and you prepare the body as best you can. Exactly. Your outcomes will hopefully be a lot better.
Yep, and they've shown that less nights in hospital. And just to think about, as you mentioned, the side effects, one of the biggest side effects that I know that people with cancer is tiredness, fatigue. That is not like any normal tiredness. It is just the most debilitating. I've heard people say they're out and they suddenly have to get home. This tiredness takes over them. And there's the cancer, the treatments, what you're going through, the various drugs you're going, they all add up to giving this. But they have shown, one of the largest groups of studies that have done has been on looking at what exercise or staying active does to fatigue. And the evidence is convincing that it will either give you a kind of palliative feel good. So it's almost, if you're going through treatment, it won't suddenly give you energy, but it will make you feel that if you're going to sleep, it's a better sleep than the fatigue that you get. And after treatment, it has a recuperative effect. So there is evidence to show that one of the strongest things is that rest is not best. Now, having said that, what I don't want anybody listening is to say, I'm going to go right out and I'm going to do this and do that. You really have to pace yourself. So you have to make sure that if you're doing any activity, at the end of it, your body feels energized, not washed out. So that way, when I take classes or anything, at the end of it, I can see people coming in, they're like, hi, Anna, I feel awful. And at the end of it, they've actually got a spring in their step because that exercise has boosted their healthy cells, their feel-good factor, and that's what you want. And it will help. So fatigue's the big one where we have shown that actually moving does matter. So move as much as you can, but pace yourself. So if you think, I'm feeling great, I'm going to see my friends, I'm going to wash the back door, I'm going to go and do this, I'm going to go to, that's too much. You got it, because you'll be flat in your back the next day. Just say, I'm feeling good, I'm going to energize myself with a brisk walk or whatever.
Yeah, and as you say, like, there's, people listening and anyone who listens back to this, and you'll have people at very different stages. So you could be, and also, you could have different diagnoses, different stages. You could be diagnosed with the same type of cancer and react differently. So it's all about thinking of you as an individual, your own current health status, and what those goals may be. And like you say, bringing in rest and recovery is so important, but moving is really important, because I think, and I know we've got the other question around where we are in the UK, but I think some people find the barrier is that permission to move, and often they're looking for that permission from healthcare professionals that, you sat in a room with your consultant and they really do provide that moment that says, you put your trust in them, and if they say do this, you'll do it, likelihood, and if they say don't. So where are we with, because I know that we still, we have some health professionals that are absolutely incredible, like for our 5K away groups and our online programs, we have health professionals that love it, will refer and everything, but we also have barriers with some that say, no, I'm not going to tell my patients that, I'm going to make them rest, like I'm not confident in this area. So how are we breaking down these, or how can we break down these barriers? And what's, in the UK, what's your feeling around being, signposting to, or telling people to be active?
I think there's one of the main things is, you're right. I mean, somebody told me that their consultant said, yeah, you can do a little bit of exercise, but not too much.
Yeah.
What does that mean?
Yeah.
So I think we need to still educate the oncologists, the surgeons, the nurses on where the evidence is so strong and convincing that it is beneficial. And yes, I think, that where how much is enough, we now have, and that's where the second lot of guidelines, where we've actually, if a participant or a client or a patient has a specific side effect that they mostly want to deal with exercise, we've got the pill for them. So exercise prescription has now been, if somebody says the main thing they have is fatigue, the pill we give them is different from what we give somebody who's got lymphedema, which is different from somebody who's got depression. So the new guidelines are different. So it's not just everybody has to do 5 times a week of aerobic exercise for 30 minutes. If it is fatigue, it can actually be, we want you to do 2 lots of strength and 2 lots of aerobic, and we want you to do 60 minutes. Yeah. So the new guidelines are changing. But to be honest, there's no way healthcare professionals are going to be able to do that prescription. No. What we need is them to feel confident enough to refer to the people who can do that, who are either CanRehab instructors or clinical exercise practitioners with a degree. And this is where the role for me, and this is exciting, but is we're almost on the cusp of getting the healthcare professionals to accept us as cancer exercise experts as part of the healthcare profession. And I think the whole prehab, and now with you know, Macmillan are working with us to try and get some kind of professional stamp, that we will now be able to say to the oncologists, the surgeons, the nurses, the physios, we are here, we are part of the healthcare system, just send that referral note and we'll do the hard bit about getting the appropriate individualized safe program for your patient. So we're nearly there. We're not, as you say, maybe I would say one of the best places for working in that internationally is Australia and Canada, where they have a kind of universal healthcare system, and they now have clinical exercise practitioners or physios who are now qualified to do that work. So we're nearly there. I think we're still, as you say, that we find that a lot of doctors are very keen, but they just don't know what to do. So they need to be able to refer. So we're not there yet, but that's one of my main things that I'm working at the moment is professional workforce development.
Yeah, and Anna, are you looking at like Australia and Canada and going, they have a model that works? I mean, their healthcare systems are probably slightly different. Can we take that and mold it into our healthcare systems? Are you kind of trying to look at how that works?
Yeah. There's a group of us, academics, cancer charities, physios, who are working very strongly with ESSA, which is the Australian Sports and Exercise Clinical Exercise Practitioners. And we now have, you know, we're working with the Royal College of Anaesthetists, we're working with professional standards agencies. So that's what I'm saying, it is looking really good that we will have something that replicates. And, you know, and I think with the coronavirus and what's been happening about, you know, people having to be active, we've got more chance of saying this has to be part of a referral pathway. So yeah, we're not there yet. And I would say it'll be another 1 or 2 years, but we should have much more. And it's not just only cancer, we're talking about that, but it's cardiac, neuromuscular, all these type of people. They really need to be given these specific practitioners that will help them get them back to activity.
And like you said, cardiac rehab is pretty much instilled in their pathway from diagnosis to, so why can't cancer be the same, especially when the evidence is so strong? So I was going to ask you, I know quite a few people will be really interested. You mentioned around the guidelines around the current guidelines around exercise and cancer, and then also around specific side effects. So I know we've got a lot of cancer rehab specialists listening in. So where can they find that information? Because often it is a minefield of where the hell we get everything from.
Exactly. Well, we've made a kind of infographic, you know, that's the best way.
Yeah.
So if I was to send you the infographic, you could send it out. So what it is it will tell you the normal guidelines, and then it'll have specific side effects like fatigue, lymphedema, depression, quality of life. And, you know, we've only got the big ones at the moment. We're now studying peripheral neuropathy, cognitive dysfunction, sleep quality, a lot of other things that will be gradually be able to put them in as well. So there'll be different pills, but I will send the infographic for where we are at the moment. And
that'd be brilliant. And if we can share that, that would be awesome. Absolutely. Anna, how do you have time to sleep at night?
I don't know. And I think that's the thing, when you love something, you just want to. And I think to be honest, I'm stepping away from the academic research now, because there are great younger early career researchers, and I want to support them to get the grants to do the next tier. So the 2 big things I have at the moment are well, there's three big things. So one is professional practice. So I want to make sure that we as cancer exercise experts are considered as healthcare professionals, that everybody in the medical care system is confident to refer to us. Secondly is to work, and this is something of interesting, to help develop cancer rehab in lower and middle income countries where they have nothing. So working with some of the countries like Jamaica to set up something there. And last but not least is to set up this trust, CanRehab Trust, which is a charity where we are trying to provide, like you're doing with Move, that we will have instructors, CanRehab registered instructors, who will then be able to provide a special individualized program for anybody with a cancer for a set time, and the fundraising will pay for that.
Yeah.
And that's what the dream is. That's something very, and that's why I think, we should work together to make sure that there is something linking that, we have that same offer or similar offer.
Yeah, absolutely. And like, I think me and Anna were discussing before, before the call, like, myself and Lucy from a Move Charity and 5K point of view, we are, partnership work is so important, and working together and, sharing that knowledge and insight. And that's why we wanted to bring you on today, Anna, and especially as our, last before we finish, because I think so many people will be so inspired by you to then want to, either go into this area of work or just be inspired to keep, I think, because some people, there's a lot of, with lockdown and COVID, there's been a lot, it's tiring, it's been hard on people, but actually we need to be motivated in this area of work to keep pushing and getting cancer rehab to the forefront of these treatments. And I think what's so amazing for me is I sat in a hospital in 2012 when I was diagnosed with cancer, and the one thing I said a day after was, I'd love to have got my diagnosis, and then I'd love to have got an exercise plan. I'm probably the only one who said that as a cancer patient, but the only reason I started Move really was because I was like, well, where's somebody telling me what I can and can't do exercise wise? I was like, I've got no guidance whatsoever. So to hear you talking, to see how far we are even from 2012 to now is pretty amazing.
Yeah, and I think there are so many people who really want and need that. It's amazing because I think through lockdown, and especially people with cancer who maybe were set to get their treatment and then suddenly it was delayed or it's been postponed, that's when a lot of people have said, what can I do? And they need somebody to help them go through this phase. And that's where I think there is huge opportunities. And now with people being more comfortable with Zoom, it doesn't, you live in a rural area or you're still, not able to go out because you want to shield yourself. With Zoom and everything like this, we can find ways. I've actually been with Club La Santa on a couple of classes.
Oh, have you? You love
it? Brilliant. Doing my exercise in my living room as if I was in a resort doing something. So it's changing for the better as far as, more accessibility.
Yeah. So like you say, there's no excuse, is there? And actually, like, some people are more comfortable in their own home doing things, and there's no reason why not to, if you can get comfortable on the Zoom and those platforms. And what I was going to say is our good friend, well, not quite a good friend, but definitely not a good friend, Boris Johnson is, let's not get onto him. Yeah. Gosh, I'm not even going to go there. But basically coming out now is how important exercise is during COVID and the current situation. So, exercise, they've been making cities into cycleways, encouraging walking, and it's become apparent again that, with another disease and virus, that how important exercise is in order to, fight those diseases and put you at a better chance of survival. So how important, like, I guess, bringing in cancer into that, if you are going through cancer treatment right now, or you're in recovery and COVID's going on at the same time, does it make bringing exercise and movement into your life even more important during this current time?
Yeah, and we've been working with a few people with home-based programs, and to be honest, one of the biggest things is the psychological aspect of it. Yeah. We all know that, we're exercising, it can help us cardiorespiratory fitness definitely improves, our muscular strength. So these are things that when you're going through treatment, definitely, as you said, you might not suddenly get fitter, but you'll stop that decline. Yeah. But when you're actually, you know, either isolated at home and worried, what we found is having somebody who's saying, right, here's something you're going to do. We're going to make you do this, and you're going to try that, and you're going to do something positive for yourself that'll help you get ready so that when you go back, you'll be stronger psychologically. That's where we found huge. I mean, a lot of people have come onto programs, and it's more the emotional support sometimes that they're needing. But the fact that a lot of the CanRehab instructors have qualifications in motivational interviewing, healthy conversations, so they know, obviously within their boundaries, they're not psychiatrists, psychologists, or nutritionists, whatever, but they do know that they have certain knowledge and advice that they can give. So it's been an amazing experience to find out what we can do with people who are affected by cancer in the middle of the shielding you know, stage, that people have found that it's actually been maybe for a lot of ones the first time they've ever thought of becoming active. And as you say, it's not making them run, you know, around the block. It could be a little home base walking up and down the stairs, but it really is for every person, it's individualized. And that's what you know with the people I'm sure you come across. One size does not fit all, and that's where no matter what cancer you've got, everybody's different. No matter what treatments you've got, everybody's different. Everybody gets different side effects. Some people say when they're on hormone treatment it's hellish, and then other people say no problem at all. It's so different. But that's why by tailoring it to what is it that you'd like to get out of it is so important when you're giving programs. Because for some person it might be, I want to do the 5K my way, your way run every Saturday, and somebody else be just like, I just want to be able to get back to my work, you know?
And that's why, like, I think there's a huge need for the individualized programs, and I think all of the other support groups are really, really great in terms of, you know, being that next step or that first step where it's more unstructured exercise. I think there's an importance for that, and we know that there's a, you know, we're one of them with 5K Away. We know there's other support groups, Macmillan, even the group sessions. But actually that individual support, I know that when I went through my diagnosis, and I know a lot of people would say, like, what does it mean for me and my diagnosis, and what can I then go on to do? And like we've seen incredible stories from people that have, you know, not been able to walk up some stairs to now after 8 weeks they're able to do so much more than they ever thought they could do. And like you say, I think during the lockdown, it was that mental release because people were shielding and stuck at home, and you need something else, and otherwise you will sit down all day and not do anything because you're always in the house.
I know.
So that's why, like, the Safe Fit program's been so important for you guys as well.
I mean, a Safe Fit, just for those who don't know, it is a trial of a service, so it's not up and running yet, but we wanted to see, especially during the COVID lockdown, if we could provide with qualified instructors some kind of program for anybody who is interested, and it would be exercise but also psychological and nutritional support. And we did a triage, and so that if you maybe aren't able to do any exercise for whatever reason, we'd still support you with nutrition or psychological. And again, one of the main things is you found is lack of confidence. People are so afraid, you know, and I think that's where it's almost saying, yes, you can do it. It's almost people are, during treatments, they are so afraid to do anything in case it makes things worse. And just having that confidence by somebody says, look, the evidence shows that this is actually not harmful, but actually will be beneficial. But during the COVID, where I think even more on top of the cancers, the blooming virus, they're even more afraid. And so being able to give them confidence that, look, what you're feeling is normal, and here's what we can do to help you get through this phase.
And it's so important. And people, what we'll do as well, we've shared it on Twitter before, but we'll reshare the Safe Fit. So if anybody is watching and who wants to join that program or self-refer, we will share that, so the links are available. So Anna, are you just a question? I have got one more question before we kind of start to wrap up, but are you still teaching? Do you nip it, like, in terms of delivering cancer rehab stuff? Because I know you like to do some classes.
I love it. At the moment not, and that's why I've gone down to 2 days a week at uni, because I want to go back to actually taking people. And I love the group. I love taking a group class. I love the bond, I love the laugh, I love putting on the silly music. So my plan is to get back to doing that locally. I live in Perth, which is north of Glasgow, so there's some local opportunities that I can get back in and help out there.
Oh, that's brilliant.
That's what it's all about, really, isn't it?
Yeah, and I've seen, like, we've shared and I've seen all the videos that have come back from the Macmillan ones that you recorded, and you're brilliant. If I had you as my cancer rehab instructor, I'd have been moving a lot quicker than I was initially.
Well, actually, it's funny because you go, oh my God, here's Anna, she works us too hard. They love it. So I'd be working too hard, definitely, because I think some people still wrap people up with cotton wool and say, just do a gentle tap, and I'm like, get those arms moving.
Yeah, definitely. And just while we're on that conversation, I know that you went to Denmark and saw a lot of their classes.
Yeah.
And I just love to give people a little insight into that high intensity work when you're going through your treatment, because I think, like we say, just moving and reducing sitting is really important, but actually it is really interesting to look at that high intensity work and what people actually are doing. So can you kind of go into that a little bit?
Yeah, I mean, that started, the Danish decided they were going to look at what happens if you actually give people high intensity exercise, as in aerobic, and getting people where they're really getting breathless and their heart rate's up at about 80% of their maximum. Or alternative, if you give them weights and they're doing like 8 rep max, so it's not just like 20 little ones, it's pushing them. And they showed it was safe no matter what cancer, what type. They have shown that there's benefits, particularly with fatigue, and also your cardiorespiratory fitness gets even better. And one of the big studies, he showed that it doesn't increase your risk of lymphedema, because a lot of people are afraid that if they do weights, they're going to get lymphedema. Nothing there as well. But one of the most amazing things is Morten Quist, who's a colleague, who actually has a big, large randomized trial where he's looking at what happens when you give exercise to advanced inoperable lung cancer patients. So the cancer's so advanced in their lungs that they can't get operated on. He gives them spin class, high intensity, and this video of about 20 of them cycling away like mad is amazing.
Really? Wow.
Yeah. And they said, thank you, because their oncologist had just said to them, sorry, there's nothing else we can do for you. And then he's like this big, tall Danish guy, right, guys, in here, you're going to be working hard now. And they say, oh, somebody still believes that we've got a life that we should be working hard to make the best of.
And like you say, I bet that just the benefits of doing that really outweigh any of the risks.
Oh, absolutely.
Yeah. So why is it taking a while for that mentality or that way of training to come over to the UK? Because I remember when we went on the Danish, the Club La Santa trips with the Danes, and there's not many risk assessments. Like, it was amazing. We were like, do you fill out risk assessments? Not really. And it was kind of like, you do what your body and you think capable of, but we're going to try and, we're going to push you as well. So why is that taking kind of a long time to come over to here?
And, we're not a country like America where we get sued a lot, but I think there's still the medical form where we have to take care of people rather than saying you have to listen to your own body and maybe manage what you can do, and we're going to be there to support you. So there's still that, and that's why I don't want it to be part of the NHS too much, where you have to check everything and screen, and there'll be so many things that they'll be excluded from doing. Because if they saw the Danes, so the Danes have that attitude that yes, they have a physiotherapist who maybe check their blood pressure and just check the middle chemo, are you feeling all right? And as soon as they say yes or no, they will decide whether they can do that class that day. And that's kind of what my attitude is. Let's not over medicalize it. So when I have people coming with chemo to my class, the only thing I'd say is, if you've not had your chemo because your blood counts are too low, or if you fainted or vomited or had diarrhea over the last day or two, don't come. Otherwise, even if you're feeling so tired, come and do the first 5 or 10 minutes and then you'll feel better. So it's trying to make it a very simple rather than, and that's where the Danes have said, you listen to your body, we're here to support you. If there is any issues you want to ask about, but, you know, let's not make it that you have to be, you know, super fit and healthy to come to the class. It's got to be, you want to get something out of it, as literally as much as you like.
We need more Danes and more Annas in the world, don't we? But hopefully, like, we'll start to, like, you know, the more work that you are doing and that we're feeding in with, and the more we can keep spreading that message to highlight that.
I know.
I think sometimes as a cancer rehab instructor, it's that first step where you are nervous about working with someone, and then after a couple of weeks, you're like, oh, I know what they can do now. We can really go. But like you say, it's that patient also providing the feedback and, you know, being willing to listen to their body as well. But I definitely think, if we can take some more inspiration from the work going on in Denmark and Australia and Canada, then the more that we'll be confident to say, you know, we can do this with people living with and beyond cancer.
Yeah, and being nervous initially is fine. That shows you're conscientious and you want to get it right. And I'm like that always. I think most instructors, even with the Safe Fit, they do say at first, they're like, oh my goodness, am I doing this right? And then they relax into it. So they do, and it's because they want to get it right and don't want to cause any harm. But as they get to know their participant, they feel more comfortable about saying, right, let's up it a little bit. And that means that they feel confident as well, that they are not, you know, saying, oh, that was terrible, I'm never going back. They're gradually building up the confidence. Yeah,
and like we've worked with like a lot of young people over the years, and we've never had one who's got halfway through the program and hasn't gone, wow, how well I've done, or how much I've progressed, or, you know, this has really kind of changed the way I think about exercise, and I'm so glad I've done this. And and
just to say, with teenagers and young adults and children, it's so important, because the evidence shows if they are inactive during their treatment, it can be 20 years later, 30 years later, that there are more increased risk of cardiovascular disease. So really, it is so important that long term they get into that healthy attitude as far as diet and exercise, so that long term they've not got, you know, side effects in their 40s.
Absolutely. And like you say, it's about creating positive relationships with nutrition and exercise, which can be thrown up in the air when you have cancer. Even nutrition is, you know, what you put in your body during your cancer treatment. You know, I was Dr. Pepper and Doritos every day. If I carried on that, I'd be looking very different to what I do now. But like that, you know, we need to get back into a positive relationship. And if you can work with people like your cancer rehab instructor, or, you know, go to a group that will help you do that, you will be better off years down the line. Because I think we've both seen people who have been really inactive, had treatment 15 years ago, and are really, really struggling now. And that can be avoided if it's brought in earlier into that pathway.
But it's never too late to start. That's the thing.
No, exactly. Definitely. So I think we're going to wrap it up there. I could talk to you I could have done a 2-hour.
Is that the time gone already?
I know. I'm going to look to do a podcast with you, Anna, because I think we could talk about this for hours. But I've just got a comment actually from Helen, who's our cancer rehab instructor. So I'm just going to read this off Facebook. She said, excited to follow this. I owe you both so much. Anna for letting me on your course, and Gemma for taking a chance with me with Move. I'm just finishing off some programs for Move, and it's been an incredible 2 years since doing the cancer rehab course. I'll leave you with a quote from one of the young people who finished the program recently. Thank you, Gemma, for founding Move. It's helped me so much mentally and physically, and having spent so long not being able to move, now I just want to move all the time.
That is wonderful. That's what it's all about.
Exactly. So I think that's a perfect kind of way to end this question and answer. And we've got people, Liz, so hi Liz, saying totally agree with Anna. We need more Annas.
You need any puppies?
Oh, is that your puppy?
Yes.
Oh, lovely. We need more Annas and more puppies. Is it a he or a she?
It's a she. It's a little chocolate cocker spaniel.
Oh, lovely. What's her name?
Beara, like bear with an A at the end.
Oh, lovely. Sarah. I bet she's loved having you in lockdown at home all the time.
Oh yes, and she's getting lots of exercise, or she's keeping me active with all the walks we go.
Oh, bless her. Well, we just want to say, so Thomas has said, thank you, Gemma and Anna. This has been very insightful discussion, much appreciated. So no problem at all. And I think we could come on a question and answer again in a couple of months' time and have even more to talk about. So thank you so much.
Specific topics, Gemma, just let me know and we can prepare. for that.
Yeah, and maybe that's something that we should work together to bring to the forefront, because I think there's information there that people, especially cancer researchers, may have not known that was available. So we will try and share as much resources and links and information as we can, and to the Safe Fit programme for anybody who wants to be referred. And this also question answer, if you missed some of it, will also be recorded and we'll share on our website, and we'll reshare on Facebook as well, and we could share with you, Anna, as well. So thank you very much, everybody, for your time. Lorna's also said fabulous, 2 great inspirational women. So hi, Lorna. Hopefully we can have a drink in the Sunny Club La Santa at some point.
Yes, I know. Look forward to that.
That'll be brilliant. So I'll take us off Facebook Live now. So we'll have a great evening, everybody, and we'll see you guys soon. Bye.
Bye.